This is an Evergreen Media Network studio production.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. My name is Isele. I'm the CEO of Treasure Coast Community Health and happy to be here every week bringing interesting guests to have a conversation about timely topics. Nothing political, nothing too controversial, just a lot of good folks that are doing good work in our community that you may or may not know a lot about. So today I'm pleased to have Frank Isele back from the Indian River County Hospital Tax District. That's a mouthful.
Indeed it is.
And Frank has got a number of updates. You know, the hospital district is a taxing authority, one of only a little less than a dozen in the entire state. And we are so fortunate to be able to have this special tax district, not because taxes are wonderful, because I think we'd all agree that we'd just as soon do without many of the things we have to do or have to pay for. But it enables our county to be one of the healthiest in the whole state of Florida, supporting a lot of wonderful work that's being done. They help us stay on point by challenging us about not being duplicative. Are there things that we can do collaboratively instead of solo? And so they've really kept our healthcare community together and enriched the community in a number of ways. And so I want to say thank you to the Hospital Tax District trustees that are elected by the residents of this community, but also to you as taxpayers. I want to endorse It is money very well spent when you look back and across different hospital districts in the state, really. So, welcome.
I thank you, Vicki. Thank you for the introduction. And first of all, thank you to Treasure Coast Community Health and you for everything you guys do. You make a massive impact on this community in a way that in a way that is very much needed. And I'm so grateful that you're here. Thank you.
You know, we're going to keep expanding to meet that
and
need.
That's, of course, I hope you are, because the need is there.
Yeah.
And honestly, I wouldn't know that if I hadn't spent 30 years in healthcare. But after 30 years in healthcare, working in 3 different states and many different communities, I know firsthand the importance of how we as the hospital district can impact organizations like Treasure Coast Community Health and others. But what you do with your funding and how needed that funding is and how I anticipate the need in healthcare in our community not going away, but in fact getting greater. And to your point about our trustees, we have a fantastic group of 7 elected trustees who have the passion, who have the commitment. Now, granted, this is an unpaid position.
It is.
And they do a fantastic job. We have such a great group of trustees, and they are... we are working together right now to plan our future for what the Indian River County will look like in terms of healthcare in 10 years. And I think we have a lot of great discussion around that, a lot of great ideas around that. But Treasure Coast Community Health is an integral part of that. So I'm so grateful for everything you guys do.
Thank you again. And I hope that you will be at our newest endeavor. We have had our mobile van delivered, which we got through a grant, which was wonderful. So we're going to have ribbon cutting. Never had a ribbon cutting for a mobile, but in coordination with conversations with the VNA and Whole Family Health, we're establishing a route. And so next Tuesday, I think that's the 13th, at 5-ish at our Oslo Road site. We're going to have not only a ribbon cutting, but we'll open the doors and let everybody see it. It has a lift for wheelchair folks, as well as 2 separate exam rooms, a waiting room, very little, but in case it's raining, as it often does in Florida, we tried to think of everything so that we can take it out and put in places, whether it's for a half day or a full day, that could use the care in their neighborhoods. So.
Well, I'm excited to be there, and I'm honored to be there. And I will say that that was a very wise investment on behalf of Treasure Coast Community Health and your board. That's the future. I mean, the nature of an FQHC and the nature of community health and the future of healthcare in our county is to go to where the patients are.
As the hospital just showed us
Indeed.
with hospital
Acute care
at home.
Yeah. Acute care. And that's the future. And actually, I just spent 2 weeks ago, I was in Las Vegas learning about nationally how acute care at home and the hospital at home model is spreading across the whole country. And in fact, Cleveland Clinic and our community are pioneers in that. And it's something that I think is going to be a much larger part of healthcare delivery services in the future than we currently anticipate. And mobile is going to always be a portion of that. So that was a very wise investment.
Thank you.
I'm glad you did it.
Well, I'm glad
we're
our
happy
board
to support
endorsed it, and
Yeah,
the
yeah.
grant was there.
Indeed.
You know, so it's grabbing that brass ring as it goes around. You might not see it coming, but when it's right there at your side, you go, yeah, we could do that. We should do that.
But those decisions are very thoughtfully, I mean, they were very well planned and very thoughtful. And that is, in fact, I mean, you guys, Treasure Coast, you guys are on the cutting edge of not where healthcare has been, but where healthcare is going. So,
as long as it's not the bleeding edge.
No.
But again, this community has been very supportive, and we hope that they will continue supporting us. You know, our mission has been, and our tagline for many years was healthcare for all. Having had not an impoverished childhood, but certainly not an affluent one, I understand that there's a whole range of expectations, and we can't be everything for everyone. But I do believe that healthcare is a basic necessity for everyone, regardless of their income, their stature, their education. And so I'm hopeful that more people today, as we are out more, will believe and trust that our highest quality is being delivered there. It's not just whatever. We really have excellent providers. They're board certified. They come to us with experience, and they add on to their experience. We support continuing medical education for them and their staff because we do believe that the rate of change, the developments that are happening, everybody's got to keep up. And as you say, even look forward to be on the edge, because if you don't, if you blink twice, you're behind the eight ball in terms of what people need and what they can have as, I hate to say convenience, but certainly that's a part of it.
Indeed. And we found our partnership with Treasure Coast. We share that same vision. We share that same philosophy, healthcare for all, making sure that the hospital district touches every patient in every corner of our county.
Exactly.
Everyone is informed about what's available. And, you know, obviously, you know, folks seek care as they feel comfortable to do so. But we want to make sure they have the information about that, they have the access to it, and it's affordable. And through our partnership has been a very positive and a very successful partnership, and I expect that to continue. Treasure Coast is an integral part of this community, and integral, forget that, a critical part of this community. And the services you provide and your anticipated growth, and I expect the demand. I mean, we see the population growth and how it's happening in Florida, how it's happening in our county.
Well, and those of us that have been here for some time, we're aging, and so we're in the Medicare ranks. And in the past, you know, everyone would try to have a primary care provider, and then from that, you would be referred to specialists, whether it was for your lungs or your heart or whatever it was. And then over time, people got used to seeing the specialist and not so much their primary care provider. And we're going constantly back to that model, because that's the coordinator, that's your support system, not just medically, but sometimes in those socioeconomic factors that can affect how often you can see your provider, your primary care individual that guides you. And so I don't want this to turn into the TCCH show. That's not why you were invited here, okay? So I'm a little embarrassed at saying this. Tell us about some of your other updates, okay?
Well, we've got, thank you, Vicki, and it's never, I mean, to talk about all the value that TCCH brings is always time well spent.
Okay.
And as I've said, you've been a great partner. Well, being new here, so I'm 5 months on the job now. Learned a lot, still learning, and get after 30 years in healthcare and the operations side and the provider side, you know, transitioning for me, just getting to know our community and spending a lot of time to participate in as many things as I can to truly understand the needs of our community. And
you're at the Chamber Leadership Group now.
Indeed, and I have to tell you, Dory and the Chamber, they put on a fantastic program.
That's what I've heard.
So far, we've had 2 sessions, and it's been really fantastic. But it's really plugged me into the history and the legacy of our county, and truly understanding the industry that really that was at the beginning was our orange
citrus,
groves and citrus, exactly, and understanding that and just understanding just a lot of the dynamics and the mechanics of our growth over the years, of which healthcare is a big part of, and I anticipate healthcare will continue to be a big part of. So at the hospital district, we have several different things going on. I generally don't like to talk about things until I have some good teeth behind them and I have some good meat to talk about. But, just some recent things that are going on that some folks may be seeing in the media are University of Florida. So with University of Florida, their psychiatry and behavioral and mental health, they had left the area after a long-term commitment of at least 15 years, which was far beyond what was expected, and did a phenomenal job caring for many patients. Yes. When we had heard about their departure, this is where the hospital district steps in. So we have our 30,000-foot view, and this is one of our responsibilities is to convene our healthcare providers and talk about how we can provide solutions to when something significant happens. Something significant at this case was UF having to leave, University of Florida Mental Health having to leave after, amassing 2,600 active patients, of which 300 were children. Yeah. And so making sure that we pulled the community together and solved the problem to make sure everyone had a smooth transition of care. And the ER at Cleveland was not overrun with folks who were confused and wanted to make sure they had a smooth landing and a smooth transition. I can't say enough about our community organizations and how everyone came together.
And the Mental Health Collaborative, which
Fantastic.
was, I don't want to call it an offshoot, but it was part of the whole, what can we as a community do to improve mental health, pulling people together, again, many years ago. And those people were not just providers, but law enforcement, funders, a lot of different folks came together. As we talked about UF coming on board, Ellie McCabe's foundation was very substantial in helping both of those projects. And yet the Mental Health Association and the Mental Health Collaborative and Treasure Coast. It's nice to have the district help us with that as well. We're going to have to take just a minute for a break for our sponsors, and then we'll come back. Time's flying right along here. We'll be back in just a moment. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, and all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Pollywood. We're having a big February clearance sale, which includes all Tommy Bahama and Lexington in stock or special order, 50% off. Sunshine Furniture, 1295 US 1 in Vero Beach, next to Planet Fitness. Family owned and operated since 1991. Visit our website at sunshinefurniturecasual.com and don't forget to visit our outlet and sales store directly across the street.
Sunshine Furniture, the best in every way. Sunshine. It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. EZ for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Isele. I'm part of Treasure Coast Community Health, where we provide primary care. That care is very comprehensive. Multiple locations have different configurations, but the whole idea is to make it most excellent time management for you. Sort of a one-stop shop of medical, dental, behavioral health. We also have 3 pharmacies with very discounted rates and loving, caring staff. So if you're looking for a provider, just call us at 772-257-8224, and they will ask you what is the most convenient location for you from north to south of Indian River County. Today I'm here with Frank Isele from the Indian River County Hospital Tax District. Got to get all 6 words in. And Frank has been here with us, not with us, in the county for 5 whole months now. And so he's giving us some updates because, as we were talking earlier, healthcare is moving along almost at the speed of sound. So you were talking about the closure of the University of Florida and bringing people together for that. That's sort of in our rearview mirror, except to say that if you were a University of Florida patient and you didn't get the word, maybe you were on vacation in Arizona or someplace when all of this was taking place at the end of December, and you need a caregiver now, I would encourage you to contact the Mental Health Collaborative, and they will help you with whatever your needs are, getting you connected. They don't provide direct services. They're a linkage to all the mental health agencies within our community. Or you could call Frank.
It would be happy to direct, or a mental health collaborative, because I know that Wes and the team has done a fantastic job directing folks.
So what else is going on?
Well, we've got, and this has been in the papers, unless we have some real teeth behind it, I won't discuss it. We've got a lot of things planned, but with our medical schools. So we've been in discussions with a company out of South Carolina, and we're talking about leasing some of our land that we currently have on the Cleveland Clinic campus to develop a 4-year medical school, which would have residency programs, which would generate primary care docs and perhaps psychiatry that would remain in our community. So the beauty of these residency programs is we grow our own medical students here. We provide residency programs for them here, and they end up staying in our community and providing primary care services. And this is a long-term plan. So this is for generations to come. So that would be that's the ideal scenario. And we're working through the details of that now, but it's pretty exciting because primary care, as you know, is a shortage everywhere, as is behavioral health, mental health services. So we're doing what we can to not just solve the problems for today, but also to plan for the future, which I know you're doing the same with Treasure Coast.
Yeah, we were just up in Tallahassee because the legislative session is trying to work through where do they spend our tax money, okay? And Senator that is the chairperson of the appropriations, well, she's the chief dog up there. She's put forth a bill, Live Healthy. It is her incentive to get all of the folks focused on what's important going forward. And so, again, we won't know for a few weeks until the budget gets sorted out through appropriations and consensus between the Senate and the House. But it looks very likely that they're going to be putting more funding towards educating folks in the healthcare fields, including GME, graduate medical education dollars, so that those programs can build, thrive, and keep people that are in Florida already coming to Florida for their health care. So
Yeah, and this is critically important to us because, in the past, when I've worked in different communities where we had a hard time, healthcare staffing is a major issue everywhere.
Yes.
So it's nurses, it's medical assistants, it's doctors. You'll hear about this across the board. There's many factors to that, which we won't get into now. But one of the ways to solve that is to, within the state and within our community, to grow our own, support our own, and make sure we have our own planning done. So for the future, because we don't anticipate the need to go away. We don't anticipate the need to stabilize. The need is going to increase.
And, parents and grandparents, it used to be, particularly for women, you either were guiding your daughters into something revolving around education so that you could be off when your kids were off, or into healthcare. And I have to say that a lot of that has changed over time, but we were both trained clinically before we became administrators, and it is still something that there's nothing like it, okay? I know that women have a lot of different choices. Men do too, though. And so providing care for others is something that you just have to smile about at the end of the day. You may be exhausted. You may be a little frustrated at some of the events that happen that might have been out of your control, but encourage your children and grandchildren to look at that. There's a wide variety of things for all different personality types, but we are going to need a lot of caregivers going forward.
I agree, and it's truly a calling. For me, it just always was. It just seemed like to become a clinician as you did. It just seemed like a great fit. My heart was there.
Exactly.
My heart was there, and that's how it started. And then
you don't get that out of engineering.
Somehow we stumbled into these positions where we found ourselves in administrative roles. But I'm glad, because as we worked our way up, we were able to influence more positive outcomes, more positive care in healthcare. So that was truly the benefit around it. But there's no question, we have no shortage of challenges, and the relevance, the importance, and the critical importance of TCCH, the hospital district, several other organizations in our community are so critical for our future success, for our families, for our children, for the overall prosperity of our community. I can't overstate it enough. And I wouldn't know if I hadn't done this for 30 years, but I can tell you the impact to a community by proper preparation, proper planning, proper execution of a plan to ensure that we have care for everyone in need is so important.
And thankfully, we have 7 elected individuals that feel that way. They have term limits, so there will be an election. There will be other people throwing their hat in the ring to take their turn in helping us guide the future.
Indeed. As we sit here today, we have 4 open seats. So we have 4 open seats coming up. So 1, 3, 5, and 7 it happens to be of the 7 trustees. Those are the 7 seats that are open. We do have some folks who are running for re-election. We have some folks who are not. But the importance, everyone who's on the hospital district is there with the heart and mind and making a difference for the community in mind. So I'm very grateful for that. We have fantastic
and that's
trustees,
this November?
group of trustees. That's this November, correct.
Okay, so stay tuned. We'll be seeing more in the newspapers. Again, nothing political, nothing controversial on my show. So we will not be engaging in that here. But I look forward to learning more about all of the candidates that are coming because, again, everyone brings their perspective and a slightly different background and experience. So that helps our community continue to thrive, that diversity. So thank you for being here again today.
Thank you very much.
And again, thank you that have been listening on the show today. I really appreciate your guidance as I see you out in public. I appreciate hearing that you've heard us because there's not quite the same monitoring that we would have if we were on public television. So again, thank you for all you do to keep our community the wonderful place that it is. And I'll see you next week. Thanks, Frank.